One of the most common complaints that I hear from women, and truthfully I think most doctors hear from women, particularly ones in the 35 to 50-year-old age group, would be that they are very tired. I am fatigued. Where's my energy? Frequently, those women have some anemia. Anemia is defined as a low hemoglobin or a low hematocrit or otherwise a low blood count. Anemia is almost always in this particular demographic related to menstrual flow. Let me ask you a question. When is the last time you have ever heard of an anemic man? You don't hear it. Not much. And if a man has anemia, then the next question is, does he have cancer? I mean, where exactly is the bleeding coming from? With women, of course, the answer is obvious. So when a woman has anemia, the key thing that needs to be considered is how to reduce or stop the bleeding. This is an easy question. If you can stop the bleeding, you solve the anemia. Many doctors, nurse practitioners, or physician's assistants will approach anemia a little bit differently. They'll say, well, you know, you have anemia. You need to be taking more vitamins. You need to be taking some iron. And of course, I totally agree. If somebody has anemia, they do need to be taking those things. But the key question is stopping the bleeding. So this patient came in. Within a few days, we had her scheduled. We did an endometrial ablation procedure, stopped the bleeding, and cured her anemia permanently. I just want to emphasize, I am not against having anemia treated medically. In fact, I do this all the time. I think iron therapy is good, vitamin therapy is good, and even there is a role for iron infusions, and in some rare cases maybe even blood transfusions. But the key is to get to the root of the problem. Sometimes people are focused on trying to do what their doctor says, but don't forget, the doctors sometimes are distracted. They're not looking at the big picture. It is important for you to take control of your own health. If you're having problems with anemia, think it through. We need to stop the bleeding. If you would like to talk to us some more about this and what the options are, please give us a call and we would love to help.